Terrible smile lines after Botox injection. What happened? I had a Botox injection in the high cheek area where I have some smile lines. 2 days later, I now have different deep lines, longer and wider, and they go down the whole side of my face, both sides when I smile. What happened?
Thank you for your question. You submitted a question without any supporting photos, so I'm just going to kind of conjecture as to the locations based on your description. But you stated your question that you had Botox injected high in the cheek area for smile lines, and now you've developed some long, deeper lines in a little bit around the area, and you're asking what could have happened. Well, I can certainly give you some ideas of what could be a possible issue based on your description. A little background: I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and my specialty of oculofacial plastic surgery, our group was one of the first to start using Botox when it was first FDA approved because of the indication for muscle spasms in the face, diseases or conditions called such as benign essential blepharospasm and hemifacial spasm. So I have a lot of experience using Botox. So in your description, when you say it was placed in the high cheek area for smile lines, it makes me think of maybe crow's feet lines, is what you mean. And crow's feet lines are basically the result of a muscle activity from the muscle called the orbicularis oculi muscle. Now, if the injections were done a little bit lower at the cheekbone level, then you may have also gotten some of the material injected into a muscle called the zygomaticus muscle or adjacent muscles. Now, yes, when Botox relaxes a muscle, it certainly, depending on its relationship to other muscles, there can be an effect that you don't want. When we do Botox, let's say for for a lip lift, the corners of the mouth are brought downward with aging and with volume loss, and by relaxing a muscle called the depressor anguli oris muscle, we can actually get the lip to turn upward. Now, if that Botox diffuses to another area in that same general vicinity, then it's possible to affect actual lip movement. So it's not unusual to hear about someone having an unusual response to Botox when there are several muscles in that area. It's one of the reasons why I stress that doctors who really understand facial anatomy and facial musculature, and my bias is of course towards surgeons, really understand the depths and levels that the injectables can be performed because we operate directly in that space and know these muscles very, very well. This is in contrast to people who haven't done that, or even non-physicians who are also injecting Botox. Now, that being said, I think the most important thing is to really reach out to the doctor who actually did this injection. In the absence of a photo, you can also at least potentially do something to counterbalance the effects of the Botox by maybe relaxing other muscles, but hopefully the effect that you're seeing will be a learning experience, and not that you don't like Botox, but in terms of the future, the location of the Botox, the dosage of the Botox, and the effect. Our patients who we take care of, we see for years, we get to learn from each visit how they respond and document very well the dosage and the location and the response. We routinely ask our patients to come back after 2 weeks to see the effect and know that this is the right amount for them. That's customizing. I mean, it's part of a long view relationship with the patient. This is in contrast to unfortunate commoditization of injectables, such that people bounce around and chase different incentives. So meet with the doctor, review the photos. You know, when we do anything with our patients, we always take photos, and we take photos with the movement and expression, and then relaxed, and document the different asymmetries. And you can then at least maybe look at your photos again, because sometimes people will notice something different that maybe they didn't notice as much before, because there was a presence of wrinkles or lines that really was their focus. And when that's reduced, now they notice other things. So again, it is, I guess I'm stressing over and over the importance of a long-term relationship with the cosmetic doctor to at least have a good sense of understanding as well as predictability with your injectable treatments. So I hope that was helpful. I wish you the best of luck, and thank you for your question.